is Amber Kilman. This is my Gait Development Critical Assignment presentation for my lifelong motor development class at Cal Baptist University. Exactly what is gait? Gait includes running, galloping, skipping, and hopping. And when it comes to gait, it comes all about the legs. So here in this diagram, this is the diagram of the different steps for gait. Alright, so the first one is the initial contact with the ground. Then you have the loading response when the leg starts to swing. Then right here you have the mid stance. That's when you have one foot straight on the ground. Then you have the terminal stance. That's when the foot is finished. Then you have the pre-swing, the initial swing, the mid-swing, and the terminal swing. This is what gait is. This is the diagram for gait. There are 4 different stages when it comes to gait. You have the early childhood stage, the childhood stage, the adulthood stage, and the older adulthood stage. Early childhood. At first, each step tends to be independent of the next. The toddler takes short steps with little leg and hip extension. When toddlers learn how to walk, they need a base of support. They either need a parent or they need an object like a table, a chair, a toy that they can use to help them walk. That's the base of support that they need. They don't have much of a stride. It's more like short little steps instead of a stride. And they have no arm swing. As you can see in the picture of my PowerPoint, his arms are up here. So he has no arm swing whatsoever. Early childhood theories and principles. Infants have the ability to move their legs in alternating patterns from birth onward, yet they cannot walk for at least 7 months after birth. In early childhood, toddlers try to develop walking on their own. They learn by using objects or by having their parents for support. Birth to 2 years, children are using their physical or motor skills and their senses to explore their world, develop their cognitive understanding. Infants must have muscle strength in their trunk and extend their muscles to allow them to maintain an upright posture on a small base of support. Early childhood gait abnormality. Toe walking gait with absent heel contact. When it comes to toe walking gait, it is common in children and associates with normal tone, range of motion around the feet, and normal walking on request. However, persistent toe walking is observed in spastic upper motor neurological disease. Example, cerebral palsy. When we had to watch the videos for our CAP 2 project, I saw the toddler and he didn't use heel to toe walking like you're supposed to, just like how the diagram shows. You go heel, then toe. Heel, then toe. He did toe to heel, so he did it backwards. If this isn't fixed, you can have this problem for a long time. Early childhood possible constraints. Need constant support to hold themselves up. They have to learn to balance on their own. If they don't learn how to balance on their own, then they're going to have to be using support for the rest of their life. Uses toe to heel instead of heel to toe by stepping could develop unusual walking patterns if not fixed. So, they could be pigeon-toed, they could be off balance. They have to have that heel to toe like how all of us adults do. Walking delay beyond 18 months needs investigation, particularly in boys, to exclude neuromuscular diseases, as does global delay with speech, hearing, vision, and fine motor milestones. So if they're not walking by 18 months, there's obviously a problem. Now, we move on from early childhood to childhood. So, once the infant's balance improves, she must decrease her base of support to become more mobile. So, Because when we get older, we need to learn how to balance on our own, like I was saying before with the early childhood stage. They don't need any basic support in childhood. Their stride length is longer when the child is an infant, but still short because the child is still developing. They're getting taller, their legs are getting longer, so their stride length starts to improve as they get older. They start to develop an arm swing. As you can see in the picture of my PowerPoint, she's using her an arm swing as she walks. They start to develop that instead of keeping their hands up here. And they start to understand heel first stepping, but still do a toe step. They still have a little bit of a toe step when it comes to walking. Childhood theories and principles. Stride length increases throughout mid-adolescence, partly because of the fuller range of motion at the hips, knees, and ankles, and partially because of the increase in leg length resulting from growth. The rhythm and coordination of a child's walk improve observably until age 5 or so, but beyond this age, pattern improvements are subtle and probably not detectable by the novice observer. Child gait abnormality. One I found for childhood would be clumsy gait, which is commonly used to describe difficulties in motor coordination. So hitting a wall, tripping when you're not supposed to trip, things like that, being clumsy. When we observed the older girl in the video for the CAP 3 project, I noticed that because she was walking too fast, she would trip. So these are things that children need to learn to be careful with because they can hurt themselves when they trip and fall. Childhood possible constraints. There is a frequent and familial tendency to clumsiness or in-towing. So it could come from your family. If your family has a lot of clumsiness or they go in-towing, just like I mentioned before with the early childhood, then they can develop that as well. This is the stage that running, jumping, and skipping become prevalent, so accidents such as tripping and falling could occur. So this is the stage when they learn that if they run or if they skip, they could fall, and this is the stage where they can develop and understand, okay, I can't do this in order for me to stay up and not fall. Children with hemispheresis, muscular dystrophy, and cerebral palsy could have problems with their walking development. Now that we talked about childhood, we're going to talk about adulthood. So with adulthood, it's simple. They don't need a basic support. They have a good stride. They use their arm swings freely. And their heels touch first and then their toes follow to finish the step. So they look just like this diagram right here. Adulthood theories and principles. Absolute stride length increases playing the foot flat on the ground, changes to heel, then forefoot pattern, which is the diagram. Reduces out-towing and narrows the base of support, so they don't need a base of support. Adopts a double knee lock to assist the full range of leg motion. Then double knee lock is right here. Alright? This helps them move forward with their legs. The pelvis rotation, they develop a pelvis rotation, their balance improves, and they coordinate oppositional arm swings. So that's right here, their arm swings. So as this arm comes up, the other leg comes up. So it's opposite. So if the right leg comes up, your left arm comes up. If your left leg comes up, your right arm comes up. Adult gait abnormalities. Spastic paraparetic gait. The legs are usually slightly bent at the hip and in an abducted position. The knees are extended or slightly bent, and the feet are in a plantar flexation position. The posture requires circumduction of the legs during walking. Possible constraints for adults. Structural constraints may result from osteoporosis in the joints or from a decline in muscle mass. So as you get older, you get a decline in your muscle mass. Your body starts to break down inside. So as you get older, you can start developing unusual walking patterns. They can develop balance, and fear can also constrain and gait. So if you have a disease where you can't balance, that's going to prevent you from walking correctly. And if you don't like falling or you're afraid to fall, then that's definitely going to interrupt your walking pattern. Now that we talked about adulthood, we're going to talk about the older adulthood. They don't need a base of support, but if they have a disease or they have an issue, then they can use an object to help them walk better, such as like a cane or a walker. They have a good stride, but as they age, it could shorten. Arms swing freely, but they could constrain with age. Heels touch first, then toes follow to finish the step, just like this diagram. And the stride can shorten. Older adulthood theories and principles. Individuals may change their walking patterns over time due to weight gain or loss, changes in strength or balance, injury, or gait training. There is a shorter stride length in older men. Some changes in older adults' movement patterns might relate to disease and injury in the various body tissues, especially those that result in loss of muscle strength. Bilateral vestibulopathie. Usually, incomplete peripheral vestibular deficiencies are often overlooked in patients who presenting in manifestations are less than dramatic. A typical symptom is gait unsteadiness that worsens in the dark or uneven ground. So they can have troubles with their balance when it comes to uneven ground and their steadiness. So able to keep that mid stance when it comes to their walking. Gait disturbances are among the most common symptoms in the elderly. Possible constraints in older adulthood. Disease or injury, fear of falling, balance issues. This is common in older adults. In conclusion, with my gait presentation, walking throughout life can change. In the beginning, we start out not being able to walk or move properly to being able to make our bodies function and walk properly. There can be some drastic changes to our walk because of disease or injury, but if we are able to avoid these constraints, we can walk through life without a problem. Thank you for listening to my presentation. I hope it helps. I hope it helps you understand gait more throughout the 4 different stages. Thank you very much.